I am Matt Ellefson, founder of Survive It, and we're back today to talk again with Dr. Chad Rusthoven about radiation treatments. I think a lot of people, understand that radiation is one type of therapy to treat their cancer, but a lot of people don't realize that our bodies can only tolerate so much radiation therapy. And certain organs or certain parts of your body can tolerate different amounts. Can you explain that just a little bit and why that is?
When we deliver radiation therapy, just like when we use surgery for the treatment of cancer or when we use chemotherapy or targeted therapies, the goal in an ideal situation would be to eradicate the tumor and cause no ill effects to the surrounding normal tissues. That goal is rarely achievable 100% of the time because of the properties of all the treatments that we deliver do have some collateral side effects. With radiation, one of the potential effects to the normal tissues is that it can cause fibrosis over time, which means that the tissues become you can conceptualize it by thinking that the tissues get a little bit of scar tissue in the face of radiation. And that can vary from something that's not meaningful to the patient, where they never notice that they have that, to something that's very meaningful, that's actually causing an organ to not work quite as well as it should. A classic example in lung cancer is that sometimes when we treat lung tumors, the esophagus, which is the connection between the mouth and the stomach that food goes down when we swallow, if that receives a high dose of radiation, it's possible that over time there can be some fibrosis or scar tissue in the esophagus that makes swallowing a little bit more difficult. And if that's significant enough, it can cause all sorts of problems for a patient in terms of weight loss and discomfort and things that we really have to pay attention to. And so the probability of these things happening is dependent on a couple of factors. One of them is the amount of radiation that a normal organ receives, like the esophagus, what dose of radiation it receives, and the volume of that organ that receives that dose. So a high dose of radiation to a very small point on an organ may not be very consequential because a little bit of scar tissue in one area might not matter so much. But a high dose of radiation to the entire cross-sectional area of the esophagus, spanning over, 10 centimeters per person, if you have fibrosis in that area, in that entire area, that can cause real problems that the patient can notice, and it can affect their quality of life. So the radiation dose and the amount of tissue that's exposed are two of the key factors. And then kind of what your question was touching on is, how much radiation can someone receive? And that kind of leads into the idea of doing radiation in the same area more than once. It's a term, the term we use for that is called re-irradiation. It's where we've treated something and at some point there seems to be some more active cancer in and around that area, and we have to think about doing radiation again to try to control the tumor. And so those situations are highly, highly individualized for the radiation oncologist. Every situation that you might encounter like that is different from patient to patient based on how much radiation was delivered the first time around, and then other things like how the patient is doing, if they're already having symptoms in that area from the radiation, what their overall health status is like, and can they tolerate more treatment? And then how important is it in terms of the patient's overall cancer picture to control that tumor in that one spot? Because the risks encountered with radiating the same spot again are always higher than the first time around. And so these types of risk-benefit considerations become very complex, and they become rather nuanced. And a lot of times we actually need quite a bit of input from the patient about what their goals are in those situations when we're embarking on a treatment that can be risky. How do you assess what what's important to the patient and whether or not embarking on a risky treatment is worthwhile in their case. And so this is a place where the physician really has to know what the patient's goals are. And the patient and the physician also has to do a good job of explaining to the patient what the potential risks of the treatment are, and their understanding of the benefits as well. So it's impossible to give you a broad strokes understanding of what that looks like in all situations. But let's just use an example. If a patient is, let's say they've had radiation to the chest, and they had their tumor controlled for some period of time, and now the cancer appears to have come back on a scan. And so the patient goes to see the radiation oncologist. Well, it's very important to know if the patient's having any ill effects from the prior radiation. So they may be having some swallowing dysfunction already. And so that's something that we, would want to ask a lot of questions about. And then we would need to put into context if there are other spots in the body that are showing cancer that has arisen. And so and that helps shape what our goals are. Is it our goal to treat this area to eradicate the cancer completely and to, improve the cancer specific outcomes for that patient? Or is our goal to shrink the tumor so that the tumor itself doesn't cause symptoms in that area, to actually palliate symptoms or to prevent new symptoms from arising? And so those goals are very different, and can shape how we think about retreating an area in a high risk location. Reirradiation, radiation, for a second or third time can be done in certain instances, and certainly we do that in our practice. But those become highly individualized discussions.
Well, that's all for this segment of Fearless Fridays. We hope it was informative to you. It certainly was to me. And I just want to remind everyone that no matter what questions you may have or concerns that you may have, always feel free to contact us at info.surviveit.org, and we will do our best to help you. Until next time, I'm Matt Ellefson. Stay strong and live fearless.